One of the most common misconceptions that I see being talked about on social media is the profile of your implant in regards to reconstruction and the discussion that you should have with your surgeon about choosing what type of profile is best for you. This is actually something that's not done in reconstruction, but I can totally understand why it's confusing. So let's talk about how we choose implant shape and size for reconstruction. I use Allergan implants, and that's just because that's what's at my facility and it's what I trained with, so it's what I'm most comfortable in. All implants have a similar but somewhat different naming structure. Allergan implants have different profiles ranging from low to extra full, and it's all randomly assigned based on the width of the implant and the amount of volume. Let's discuss an example. When you are having your breast reconstruction, if you had a mastectomy and we're replacing it with an implant, we want it to fit well on your body. So we want the width of the implant to be the width of your breast before surgery. It would look silly if it was narrow and was just sitting on the middle part of your breast. So that's why most surgeons measure base width of the breast as part of their workup. I need to see how wide your breasts are so I know how wide of an implant to choose. So we have our width, that's your anatomy. Then we choose volume. How do we choose volume? It's just whatever fits, whether or not it's placed at the time of the mastectomy or in a second stage approach where we're taking out tissue expanders. It's just whatever fits in the skin. So I don't really have a lot of flexibility when I'm choosing volume, maybe 50 cc's, which is like a tablespoon and a half. So to recap, width is based on your anatomy. Volume is based on whatever your skin can safely cover. And that gives us the projection. Let's do an example. Let's say that your base width is only 13 centimeters. That's a very narrow base width, but I need 300 cc's, which is about a can of soda, to fill your breast. As you can imagine, narrow width, big volume is going to have a high projection. Let's contrast that to a wide base width. Let's say your base width is 15, but I can only fit 300 cc's. As you can imagine, taking that 13 centimeter base width to 15, but with the same volume is going to give less projection. Does that make sense? So projection is not something you choose, which is very different than a primary breast augmentation. I hope this clears up the confusion. We'll talk in another video about the firmness of implants, but this is how we choose implant size.